This is the Yarra Drug and Health Forum special information bulletin on our YouTube channel. And make sure if you haven't subscribed already to do so. And also at ydhf.org.au, subscribe to our newsletter for updates on events, on news that's going on, and for information like this. My name is Nick, and I'm recording this on the lands of the Wurundjeri people of the Kulin Nation. And I'd like to pay my respects to elders past and present, as well as anybody who might be watching this broadcast in the future. And I'd like to welcome our guest now, and our guest speaker today is from Family Drug Support and is the Family Support Officer, Chloe Span. Chloe, welcome.
Hi Nick, how you going?
Yeah, good. Now, Family Drug Support has recently conducted a survey. You're surveying families about attitudes to drugs. Tell us a bit about this survey and what are some of the key findings so far?
Thank you, and again, we appreciate the opportunity to come on from the Yarra Drug and Health Forums. Family Drug Support every year commemorates a special event called International Family Drug Support Day, and that's really to recognise the role of families and the work that they play in keeping their sons, daughters, partners, siblings, and family members safe long enough to make the decision to change and potentially do a recovery and, move towards a life that isn't so problematic in terms of their substance use. International FDS Day is also an important day for our organisation. It marks really the start of FDS in that our CEO, unforgivably in many ways, lost his son to a heroin overdose in King's Cross on the 24th of February in 1997. So it's been 25 years since Damien died, and we really enjoy being able to raise the voice of families, particularly on this day, which was really why our organisation has been established, because of unacceptable and really tragic deaths like Damien's. When it comes to what we've done this year, in terms of COVID and things, we didn't have any in-person events. Usually we invite politicians, we invite family members, and a whole lot of people who are sort of affected by this issue in many ways to come together and celebrate everything that they do, the important work that they do. This year, instead, we ran a survey, and we were able to get over 600 responses from family members all across Australia. And while the results aren't necessarily something that is surprising to us, it's really confirmed a lot of suspicions that we had. Really overwhelming support for harm reduction services. And when we say that, we mean injecting centres, we mean needle and syringe programs, we mean drug checking and pill testing. We're talking about services that often might be considered controversial in an Australian context, but yet what we're hearing from families who know this situation really intimately, they live this every day, of trying to support somebody who's really chaotic in their substance use or is taking a lot of risks in their substance use. And they want harm reduction. They understand the value of doing these sorts of strategies because they see and understand that they do save lives. So that was one of the biggest findings from the report.
That's a great summary of some of the findings, and I guess demonstrating that families do want to see change, and it kind of counters this idea that families somehow believe that prohibition will keep their children safe from, the scourge of drugs, which is the sort of language that we hear sometimes in our tabloid press. But the truth of these things is much more human. It's a much more complex problem. It deserves a much more human response, and that's sort of what the data seems to be showing, that people are supporting these more involved, complex responses.
And I think that that's something that when you think about the people who are responding to this survey, they're really experts in their own loved ones. They very rarely have a voice when it comes to decisions that are made for them in terms of drug policy and other sort of systemic issues that impact on them. We hear a lot of people that get, a large kind of platform to talk about drug policy, politicians, religious leaders, all sorts of people get a voice on this stuff, although families and, of course, people who use drugs themselves are really sort of neglected in the policy debate. So I think one of the largest findings for myself that came out of this is that families are impatient for change. There was a huge lot of support for wanting a health-based approach to this. They don't want to see their loved one or family member ending up in prison. They want a compassionate response. They don't want to see police knocking on the front door doing arrests for possession charges. And in fact, that was another one of the findings in the survey, was that there was about 79% of respondents supported a decriminalisation approach to substance use in various forms. That's a very high percentage for people who, I've mentioned it before, but families that really understand this issue and they know what works and they know what doesn't work, and they're saying we want change. So I think that's really significant. Another one of the main findings just on that point about legalisation and regulation is there was quite a lot of support for the legalisation of cannabis. And what we mean by that, of course, is the sale and distribution in a similar way to how we have alcohol today. And again, what the findings suggest is that that's because families don't want their loved ones in contact with the justice system just because they got caught with smoking some cannabis. They're much more interested in finding ways to genuinely support them and connect in with them. And we know that families that are engaged with their loved one, that are, intentionally trying to stick through them through a lot of challenges and a lot of crises that are often cumulative, right? And they kind of, they take their toll after a while. So, people that are doing this work are very valuable in our community. They're actually doing a huge community service to everybody. What we're seeing is that, they really want change. So I think that's really significant. And they do better. Families that remain connected actually have better outcomes overall for the substance user as well as the whole family in general.
And just finally, wanted to draw you to the treatment options. I suppose the way that the families responded on how they want to see these issues dealt with. And I'm looking at page 7 and 8 of the report, and the report is in the YouTube link, so you can read it yourself as well. But can you talk to us a little bit about the support for different modes of reducing harm, and also perhaps some of this rejection of tough love? Talk to us about that as well.
Oh, yeah, absolutely. So that's a really common one, and something that, we kind of expected through the survey, except what we didn't anticipate was just the kind of sheer support that there was for a lot of the practical coping strategies that we certainly advocate for in family drug support. We're a non-denominational organisation. We're a non-religious organisation. We're reality-based, which means that we don't necessarily sugarcoat things. We tell people what we know, what the evidence suggests works, and we do a lot of psychoeducation. And families are very welcome to pick and choose what they want from that. They can leave things that they don't think are relevant to them and, maybe incorporate things that are. And when we talk about coping, and what a very overwhelming number of the participants said is that what they chose along their journey of trialling different things, trialling the hard approach, this idea of tough love, kick them out of the house, let them hit rock bottom, these sorts of things, were things that eventually in time families sort of learned that control doesn't work. And eventually a lot of the time people will come back to themselves and needing to anchor themselves and ground themselves with things like establishing healthy boundaries, personal boundaries, where do I end? Where does the other person begin? Things like self-care, of course, making sure that we've got our balance pole in check. And what I mean by that is we've got our stability and our self sorted. We still have joy in our life, even though things might be chaotic around us and things from everything that people are enduring. That's a really interesting finding too, in that what you might hear would be a sensible and logical approach to substance use and supporting someone with a dependency isn't necessarily what families really end up relying on to survive this journey intact.
Thank you for speaking with us today, Chloe, about this this fantastic report and data showing that families do support a more humane response. Just tell us quickly, if people want to find out more about family drug support, where can they go?
Definitely. So our organisation is a national organisation. You're very welcome to call our support line. So that's a 24-hour support line. The number is 1300 368 186. We have trained volunteers on that line, and often people that have lived experience with these sorts of things too, who have supported a family member. In terms of Victoria, you're very welcome to give me a call on my mobile in terms of accessing support groups, as well as our flagships program Stepping Stones for Success. I'm part-time, so if I don't answer straight away, I will definitely get back to you. I'm Wednesday, Thursday, Fridays, and my mobile number is 0448 177 083.
And I think people can find that if they sign up for the FDS information, which are
Membership,
yes. Yeah.
Thank you for
I'm
that.
just scrolling through.
Absolutely.
So you can watch on screen. We'll see you as well at a upcoming Yarra Drug and Health Forum, but thank you very much for your time today, Chloe.
Thanks, Nick.